As we age, the landscape of our lives transforms in many profound ways. Our bodies, our relationships, and our perspectives. The beauty of growing older is that it gives us the chance to reflect on our journeys, cherish our experiences, and embrace the wisdom that comes with time. We understand ourselves better, and perhaps we're more attuned to the ways in which our bodies have changed. For many seniors, this also extends to their intimate lives. But as with all things, it's important to proceed with a sense of mindfulness and awareness. While intimacy remains a vital part of life well into our golden years, it is essential to approach it with an understanding of the potential risks and changes that come with aging. Here are 5 hidden dangers of having sex after 70, along with advice on how to ensure your intimate life remains a safe and fulfilling part of your overall wellness. Welcome to our channel, where every piece of content is created with passion and inspiration. We'd love to hear where you're watching from. Please share with us, and don't forget to hit that subscribe button. Don't forget to like, share, and leave your thoughts in the comments. Your feedback means the world to us. Number 1. Physical strain on the heart. As we age, the heart, like the rest of our body, undergoes changes that can impact its efficiency and performance. For many seniors, sexual activity can place additional strain on the cardiovascular system, which may already be compromised by conditions like high blood pressure, heart disease, or arrhythmias. While sex is a natural and fulfilling part of life, it's essential to recognize that it can act as a form of physical exertion, raising heart rate and blood pressure in ways similar to moderate exercise. For those with pre-existing heart conditions, these changes can sometimes trigger symptoms like dizziness, shortness of breath, or chest pain, which may indicate underlying cardiovascular issues. Understanding these risks and taking steps to safeguard heart health is vital for ensuring both safety and enjoyment during intimacy. Maintaining a heart-healthy lifestyle is essential as we age. Regular physical activity, such as walking, swimming, or cycling, can help strengthen the heart, improve circulation, and reduce the risk of cardiovascular events. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can further support heart function. For seniors with conditions like hypertension or high cholesterol, staying on top of medications and adhering to prescribed treatments can also make a significant difference. By prioritizing overall cardiovascular health, seniors can enjoy sexual activity with less risk of complications. Consulting with a healthcare provider before engaging in sexual activity is also crucial, especially for those with a history of heart disease. Your doctor can offer personalized advice based on your specific health status and help you understand what level of exertion is safe. It's important to pace yourself during sexual activity and listen to your body's cues. Seniors should avoid rushing or pushing beyond their physical limits, as this can increase the risk of heart strain. Exploring different positions and focusing on comfort can also help reduce physical stress. Taking breaks, staying hydrated, and avoiding excessive alcohol or heavy meals before intimacy can make sexual activity more enjoyable and safer. Ultimately, heart health is integral to maintaining a fulfilling and active sex life as you age. By staying aware of the physical demands and making mindful choices, seniors can continue to embrace intimacy with confidence and care, ensuring both their emotional and physical well-being. Number 2, decreased lubrication and discomfort. As we grow older, our bodies experience hormonal shifts that can affect various aspects of our health, including sexual function. One of the most common changes that seniors, particularly women, experience is vaginal dryness. This is often a result of lower estrogen levels, which can lead to reduced lubrication and discomfort during intercourse. For men, age-related changes can affect erectile function, with many experiencing difficulty achieving or maintaining an erection, or finding that it takes longer to become aroused. These changes can lead to frustration and self-consciousness, potentially affecting the emotional and physical aspects of intimacy. However, it's important to understand that these issues are common and manageable with the right approach and resources. Using lubricants is one of the simplest and most effective ways to address vaginal dryness. There are many products available that are specifically designed to provide moisture and reduce friction, helping to make sexual activity more comfortable. For those experiencing erectile dysfunction, medications like Viagra or Cialis can be prescribed to help improve blood flow and facilitate stronger erections. In addition to medical treatments, taking time for emotional connection and foreplay can be beneficial. Often, seniors may find that focusing on emotional intimacy, rather than rushing directly into intercourse, allows for a deeper connection, reduced performance anxiety, and a more fulfilling sexual experience. Open communication with a partner is essential to make these adjustments feel less intimidating and more collaborative. Another critical aspect to managing sexual discomfort is fostering a positive attitude toward aging and body changes. While physical shifts can be challenging, they are not an indication that intimacy must end. Instead, seniors can focus on adapting and finding what works best for their current needs. Embracing a slow, relaxed pace and being open to different forms of sexual expression, such as oral sex or mutual touching, can create new avenues for pleasure. Furthermore, incorporating pelvic floor exercises, which strengthen the muscles involved in sexual function, can benefit both men and women. By taking a proactive approach to these physical changes and being patient with oneself and a partner, intimacy can continue to be an enriching and pleasurable part of life, even as the body evolves. Number 3, increased risk of injury. As we age, our bodies naturally become more vulnerable to injury, and this includes an increased risk of musculoskeletal issues like joint pain, muscle stiffness, and reduced flexibility. These changes can make engaging in physical activities, including sexual intimacy, more challenging. The strain that certain positions or movements may place on aging joints can lead to discomfort or even injury if not approached with caution. Conditions such as arthritis, osteoporosis, and general muscle weakness can significantly affect mobility and flexibility, making it harder to enjoy sex without feeling pain or fatigue. This is why it's essential to adapt to these changes, allowing for safer and more comfortable ways to engage in intimacy. One of the most effective ways to reduce the risk of injury during sex is by exploring and choosing positions that minimize physical strain. For example, positions that require less movement or provide more support, such as side lying or seated positions, can be more comfortable and less demanding on the joints. Using pillows or cushions to support the body in certain positions can also help alleviate pressure, making it easier to maintain stability and comfort. Additionally, slowing down the pace of intimacy and taking breaks when needed can help prevent overstressing muscles and joints. It's important to remember that sex doesn't have to follow a rigid script. Taking time to experiment and find what works best for your body can make all the difference. Open communication with your partner is key here. Discussing your physical needs and any discomforts can foster a more understanding and relaxed environment during intimacy. Aside from adjusting positions, it's crucial to maintain a routine that supports overall physical health and flexibility. Regular exercise, such as stretching, yoga, or gentle strength training, can improve flexibility and muscle tone, which in turn helps prevent injuries. Strengthening the core and pelvic muscles through exercises like pelvic floor training or low-impact activities can also enhance physical function and support healthy movement. Staying active in ways that are appropriate for your body not only boosts physical health, but also enhances self-confidence and mental well-being. Even simple activities like walking or swimming can significantly benefit joint health and overall mobility. Furthermore, maintaining a healthy weight reduces the stress placed on joints, especially the knees, hips, and lower back. By integrating these habits into daily life, you can foster long-term health, ensuring that intimacy remains a safe and enjoyable experience. In conclusion, the key to enjoying a fulfilling and injury-free life after 70 lies in understanding and respecting the changes that come with aging. Adjusting positions, incorporating supportive tools like pillows, and maintaining regular exercise routines that focus on flexibility and strength are all essential strategies to prevent injury. The process of adapting to these changes may feel daunting at first, but with patience and a willingness to communicate openly with a partner, intimacy can continue to be a deeply satisfying part of life. Embracing these physical changes not only enhances the quality of your experiences, but also improves your overall well-being, allowing you to live with greater confidence and comfort as you age. Number 4, medications and their side effects. As seniors age, they often take medications for various chronic conditions, such as hypertension, diabetes, or arthritis, which can play a crucial role in managing health and improving quality of life. However, many of these medications can have side effects that impact sexual function. For example, certain blood pressure medications may cause erectile dysfunction, ED, or reduce libido, while antidepressants and anti-anxiety medications can sometimes lead to decreased desire or difficulties in achieving satisfaction. These side effects are not only frustrating, but can also affect emotional well-being and relationships. It's important to recognize that these issues are common and manageable, but they require attention and open communication with a healthcare provider. The key to managing these potential side effects is to have regular conversations with your doctor about how medications are affecting your overall health. Your doctor may be able to adjust your medications or recommend alternatives that have fewer side effects. In some cases, a different class of drugs may work better with fewer implications for well-being. For example, certain blood pressure medications, such as ACE inhibitors or calcium channel blockers, are less likely to cause ED compared to others. For men experiencing erectile dysfunction due to medication, medications like Viagra or Cialis may be prescribed to help improve blood flow and restore function. Similarly, if antidepressants are causing reduced libido, your doctor may recommend switching to a different medication or adjusting the dosage. It's important not to make changes to your medications without professional guidance, as doing so could lead to unintended health consequences. Beyond adjusting medications, there are several lifestyle practices that can help alleviate the side effects caused by medication. Maintaining a healthy diet, regular physical activity, and practicing relaxation techniques can all improve overall well-being and potentially mitigate some of the negative impacts. Exercise, for example, improves circulation and can boost energy levels, while a balanced diet that includes heart-healthy foods like fruits, vegetables, and whole grains can help support both physical and emotional health. Managing stress through mindfulness, meditation, or yoga can also reduce anxiety and improve emotional intimacy with a partner, making relationships more fulfilling despite the challenges posed by medications. In addition to physical health practices, having open and supportive conversations with your partner about any changes or challenges in well-being is essential for maintaining a strong emotional connection and a fulfilling relationship. By proactively managing medications and prioritizing overall health, seniors can continue to enjoy an active and fulfilling life. Number 5. Emotional and psychological considerations. As we age, emotional and psychological changes can significantly impact our intimate lives, including physical activity and connection. Seniors may experience shifts in how they perceive their bodies or how they feel about their overall attractiveness, which can lead to feelings of insecurity or self-consciousness. These changes can be compounded by the emotional effects of aging, such as the grief of losing a partner or navigating the complexities of loneliness. For many, the emotional weight of these life transitions can lead to a reduced desire for intimacy or, in some cases, a lack of interest in close connection altogether. Recognizing these emotional factors is crucial, as they often have a profound effect on the ability to experience fulfillment in relationships. Addressing emotional and psychological challenges requires a holistic approach that prioritizes mental well-being and self-compassion. One of the first steps in this process is fostering open communication with a partner. Discussing feelings of insecurity, concerns about body image, or any emotional barriers to intimacy can create a supportive and understanding environment where both partners feel comfortable expressing their needs. These conversations can also alleviate pressure, reminding individuals that intimacy is about emotional connection as much as physical pleasure. Additionally, engaging in therapy, whether individually or as a couple, can help seniors navigate emotional difficulties that might be hindering their sexual health. Therapy provides a safe space to address grief, loss, and anxiety, offering coping strategies that allow seniors to reconnect with themselves and their partners. Incorporating self-care practices into daily life is also essential for boosting emotional and psychological well-being. Physical activity, such as walking, yoga, or swimming, not only helps with overall health, but can also improve mood and body image. Mindfulness and relaxation techniques, like meditation or deep breathing exercises, can reduce stress and help individuals feel more connected to their bodies. Moreover, finding joy in hobbies, maintaining social connections, and nurturing relationships outside of intimate ones can also provide a sense of fulfillment, reducing feelings of loneliness or isolation. By taking care of their emotional health, seniors can foster the confidence and resilience needed to embrace intimacy in a positive and fulfilling way. Ultimately, sexual health is intertwined with emotional well-being, and by prioritizing both, seniors can continue to experience a rich and connected life, regardless of age. Sexual health is just one part of the larger picture of aging well. The golden years are about embracing who you are, not just physically but emotionally and mentally. Taking care of your body through consistent exercise, proper nutrition, and sleep is essential, but so is nurturing your spirit. Being kind to yourself, finding joy in the small things, and maintaining strong, loving relationships are equally important. Healthy routines that promote overall wellness, such as staying physically active, practicing mindfulness, and maintaining social connections, will enhance your overall quality of life. And most importantly, never underestimate the power of laughter, love, and genuine connection. These elements can help you maintain a fulfilling and vibrant life, regardless of age. Thank you for tuning in. Don't forget to like, share, and hit the subscribe button. We'd love to hear your thoughts on this topic and know where you're watching from. See you next time.